Hello, everyone. Welcome to It's a Great Day to Sell Insurance. This is the morning show where the insurance industry comes for information and inspiration. I am your host, Melissa D. Hall, also known as the voice of the female agent. And y'all, we got a lot to talk about today. It is the last, well, actually, AEP is gone over. Okay, so much to talk about there. Going to all of my places that I'm live streaming. Shout out to my YouTube channel, everybody who is there viewing me on YouTube. Shout out to LinkedIn. Shout out to Facebook, my personal page, and also my lovely people in the insurance exam queen. Okay, so I'm just going ahead there, letting everybody know. Listen, as you come in, go ahead and say hello to me. Okay. Also, if you want to keep up with me as far as knowing when I'm live and all those things like that, all you have to do is just sign up for my email list, the executive board newsletter. If you go to melissadhall.com/resources, you will see it there. Again, that's melissadhall.com/resources. And listen, on today, y'all, we got so much going on today. We're going to talk about, listen, our guy, Joe Biden. Joe Biden. Hey, Joe Biden. Joe Biden, as one will say. Let me tell you something. When January 6th, it was January 5th, okay? So it was 2021, I think that January happened. Was it 2020, 2021? But anyway, the day before, right? So I'll never forget on the day, it was January 5th. This lady, we called her for insurance and she was so upset. She was like, I hate Joe Biden. I hate Joe Biden. She didn't even call him Biden. She called him Joe Biden. She was like, I hate him. I hate him. And it was just a really deep hate. And guess what happened the next day? January 6th, y'all. People really get worked up about these politics, and it's people out here hating these politicians, everything that they stand for. And we saw it. We didn't know how deep it was then. We saw it that next day, right? And so people really do hate these people. So anyway, I say that to say Joe Biden has plans for our healthcare. Okay, they got plans for our healthcare, and like I say, whether you're a Democrat or whether you're a Republican, one of the things that you cannot deny here is that, depending on what side of the aisle you're on, you got to plan for this healthcare, whether it's more, big government oversight with healthcare, whether it's more, independent, oversight when it comes to this healthcare, more, small government type of oversight when it comes to healthcare. There is, some oversight. Listen, when Obama was in office, that's when we came up with the ACA, totally disrupted the whole healthcare system. Now, if it was for good or worse, hey, that right there, that's your personal opinion. But all I know is what happened when Obama took over. Okay, and listen, y'all. Let me tell you what's going on with Joe Biden. I'm making sure I let everybody know that I'm on right now, okay, and what their plans are here. And listen, I see you all watching, so make sure you all say hello, okay? So, in a CNN report, okay, because y'all know I stay with the paperwork, Joe Biden, the Biden administration announced on Thursday 5 new measures, you all, to seek to lower healthcare costs by promoting competition. Okay, this is really big because, and you can go to CNN.com to read the whole story. But one of the most interesting points I saw here was that they are now having an independent study, okay, on the oversight of some of these clinics. Okay, let's see here. All right, I'm going to read this to you, okay, because I think this is very important when it comes to the Oak Street Health, right? When it comes to the Central Wells, those clinics that are taking this government money, okay, to target the senior population, the lower income type of population, they are now coming up with an independent report, okay, It says, meanwhile, the Centers for Medicare and Medicaid Services is releasing for the first time ownership data on federally qualified health centers and rural health centers, as it already has for hospitals, nursing homes, hospice providers, home health agencies. Making this information available helps in identifying common owners with histories of poor performance, evaluating the connection between ownership and changes in costs and outcomes, and enabling analysis on how market consolidation affects consumers. Okay, and CMS will solicit information from the public early next year about Medicare Advantage insurance plans, which now enroll about half of Medicare beneficiaries and are expected to receive more than $7 trillion from the federal government over the next decade. It is the latest step in the agency's effort to understand the impact of Medicare Advantage in growing enrollment of consumers in care. So, y'all, this is two different things that are happening here. Two different things. First thing, for the first time ever, they're having ownership data, okay, of federally qualified health centers. So, whenever you all gave out this money, you didn't come up with an oversight solution. Nobody thought, well, we're going to give all these people billions of dollars to administrate healthcare. Let's come out with an oversight. That's like rule number 1 through 12 when giving out money. You know, I forgot who did it, but a very famous business mind said how they teach people to do things is they set, check, correct. They set the expectation, they check the work, and then they correct anything. Right? I'm just like our government. They when you decide to give out billions of dollars, you don't check. I don't know. I don't know. It seems like a nuisance now. Like it's a lot of money we're giving out. It's no system to check. Okay. Anyway, also too, CMS will solicit information from the public early next year about Medicare Advantage insurance plans. Again, this hasn't been happening every year. What is the 5-star? So for those of you all who are new to the insurance industry, okay, who are new to Medicare, there's a 5-star rating system, okay? And with the 5-star rating system, like opinions are solicited, from members. There's something going on right now in the housing industry with realtors, right? So right now in the real estate market, they are trying to place the cost of getting a real estate agent on the buyer. Right now, it's the seller who pays for the real estate agent. So a homeowner can have a fair deal, right? And they need these real estate agents. Most people who are buying a home, they don't know all the ins and outs, the negotiations, things like that. The same reason why you should never be your own lawyer. The same reason why people have insurance agents and real estate agents. They make a healthy income doing this. So now the system's under attack, and I would just say that the insurance industry, the Medicare industry, is looking a lot like that. It's looking a lot like that, where it's under attack, where people can, who have the opportunity to make a great substantial income, it's under attack. They try to make the people look like, I don't know, just money hungry, no good people, when that is just so not the case. It's so many people in the insurance industry who care about the people, getting a high quality of healthcare, where I just don't see that acknowledged. And I'm sorry, maybe this isn't what you all came here to see today, or the opinion, whatever you all came here for today, but I'm just so concerned and disappointed just about our opportunity to really just, have the American dream. Not everybody's an NBA basketball player. Some people are just, hardworking insurance people who want an opportunity to create a legacy and to help people, in the way of that. And why this every year, every administration, something just comes under attack. We keep getting attacked. But and this is my thing about it, right? And then I'm going to get off my soapbox here. I just don't understand how it's always about the money, but it's never about what we have to go through as agents. It's so much service involved, okay, to be a Medicare agent, servicing our clients. It's so much emotional toll involved. It's so much oversight involved as far as keeping up with the rules every year, right? And none of that is ever taken into consideration and these reports. A lot of time it's just talking about the insurance company itself, right? And yeah, the insurance company, they definitely do have their rules, but a lot of the rules are placed on the little guys, like the agents and agencies out here to really make sure there's some type of I guess I don't want to say the word integrity, but just some type of benchmark here. And that is never included in these conversations. And it is time, NABIB, whoever, it is really time that the real scope of what we do is included. Anyway, AEP is over. Okay, let's move on to a different subject. AEP is over. Now what? For those of you all who want to sell year round, I have put up a new video on my YouTube about that. Okay, go ahead and check that out. It's how to sell year round. Guess what? OEP is coming. The open enrollment period for Medicare, that is coming. So if you want to go ahead and get started, it starts January 1st through March 30th. Listen, it's a good time of year to be in the Medicare industry, and you have a little bit longer than AEP. You have 90 days versus 57. And listen, when it comes to Medicare, it is definitely something you could do all year round. Will you have to add in other insurances to it? Yeah, you do. You do. Definitely, you want to add in your life insurance to it. You want to add in your annuities for those of you all who know that side of the business. You want to add it in. It definitely makes it a very well rounded type of career. And I will say, for those of you all who are life insurance agents who are looking into the Medicare space, I'm going to tell you, I started selling more life insurance when I got into the Medicare space because, not everybody wants to talk about death. Like life insurance, we all know it's one of the hardest things to sell. Okay. You're better off selling furniture, okay, than life insurance. And so, when I got into the health side, people, they don't mind talking about their health because you're not usually not asking them for money, and so and it's the same demographic, so one kind of fed off the other. So if you are in the life insurance industry and you're looking for something different to do, listen. Medicare is it. One hand feeds another. I invite you to check out my Medicare Masters program. If you go to agent.melissadhall.com, you can see it there. And I'm going to tell you, we are going to have our graduation on, excuse me for that. We're going to have our graduation. It's going to be this Thursday at 7 o'clock. So make sure you tune into that. Okay. Make sure you tune in. It's going to be really good. So listen, how was you all's AEP this year? Mine turned out to be really good. Really good. Like 2024 is coming. That's what I wanted to talk to you all about. 2024 is coming, and I know that a lot of you all out there have big plans for 2024. Maybe there might be some things that you didn't get to do this year that you are looking forward to get to do next year. And I just want to tell you, you can do all of those things. I have something, a freebie out there. It's called 3 Steps to Change Your Life. And it should be on my YouTube channel. You should definitely find it. And it's all about how to change your life. It's about looking at what the problem is in your life and how to solve that problem in your life. Like, what are the steps to solve it? A lot of times we have an idea, we know where we want to go, right? And we know maybe what's holding us up from there, but we haven't really thought out how we're going to solve it. Couldn't we all agree out there that usually the first way you think that you are going to solve something is usually not the way that it comes up, right? Usually something might get in your way of how you originally thought. you were going to solve a problem, and so you have to take an alternative route. And a lot of times when that happens, it's hard for people to, think through or push through when things don't work out as they plan. So on my sheet that I have, is called Three Steps to Change Your Life. It's a sheet that is laid out with different alternatives to solve your problems. 2024 could definitely be your year, and I don't want you all to go into 2024 without looking how far you came in 2023, right? 2023 might not have been perfect for you, but I guarantee you it's some things that you worked out in 2023 that you have to be proud of, and you have to take that into consideration as you make your plans for 2024. Do not forsake all of the successes that you had this year that are going to lead you into 2024. I know for me this year, definitely really, finding my happy, finding my place in so many ways, but definitely in the insurance industry, it has really been a year for me. Okay. Definitely loving what I'm doing, loving the people that I'm helping, loving my clients, just everything. I just think this year has really been a full circle year, because this is the thing. Not everybody had a bad 2023, right? Sometimes, again, just the building blocks to push you into 2024. And my 2023, it wasn't bad. I had a lot of ups and downs, but I think it got me on the right track for 2024. 2024, I'm definitely looking forward to uh, meeting a lot of you all in person. That is my goal for 2024, to have some in-person events and to help people. What are some of your goals for 2024? Let me know in the comments. Okay, I want to hear from you all. All right, then. Oh, I got some. Hey, Karen, we are in Eastern time zone. Eastern time zone, you all. Listen, I'm looking for some people who want to be guests on the show. We got a lot of great things coming up for 2024. And if you would like to be a guest, make sure you just go ahead and reply back to my email or contact me on social media. All right, you all. As always, it's a great day to sell insurance. Thank you all for tuning in. I guess that's today's show. That is today's show. Tune in on Thursday, you all. Thursday. We are having Medicare Masters graduation. Oh, hi, Karen. You found us. Okay, Karen, where are you tuning in from? Listen, Medicare Masters graduation is happening on Thursday. But again, these people who've been in my course, they waking up 10 days. They've made sales, right? They've made sales. Shout out to Deborah. Shout out to Jessica. They have made sales in these 10 days. They are amazing. Irina, we getting you coming along to my agent out in Texas. Okay. Listen, you all, they've done some phenomenal things. So I want you all to celebrate them on Thursday at 7. And if you want to sign up for Medicare Masters, you want to take your Medicare career, you might not have liked the results that you did this year, but you are like, hey, let's see. Oh, it's Karen's in New York. Shout out to Karen in New York. Okay. I love that. We got people tuning in from New York, the Big Apple. Okay. So listen, hey Karen, you ready to be a Medicare Masters? So no matter where you're at, if you want to do this business full time, okay, you can do it full time. You said you need my information. Okay. If you go to melissadhall.com/resources, you could go on there and you could sign up for Medicare Masters. Okay. And I got you there. It's free, but you do have to be full time. All right, you all. Listen, I want y'all to have a fantastic day. Okay. In Jesus' name, this week is going to be amazing for y'all. Have a blessed day. Bye bye. See you Thursday.